Welcome to Startup Health TV, where we celebrate the entrepreneurs and innovators who are transforming health. I'm your host, Logan Plaster, and I'm here with my guest, Colby Takeda, CEO and co-founder at Pear Suite. Colby, thanks for taking a minute with me.
Happy to be here.
It has been really cool to watch your journey. I think last time we spoke, we were in Miami, and you just had hired your first employee. And I think you've grown a bit since then, haven't you?
Absolutely. It was, start journeys. And I think back in the days, we had one employee. We were working with a couple organizations in Hawaii, really starting to get our groove and understand the market, understand the needs of the population we're serving. We've now have grown to about 20 employees across the country, built out our entire tech team, have implementation directors and managers supporting the work we do with other organizations, evolved their business model quite a bit. And happy to share more about that and kind of what we've been doing since then.
I want to get into the business model, exactly what you've built, but going from 1 to 20 employees, obviously it's not 100, 1,000 employees, but that's a big change for a CEO. And I'm kind of curious, what were some of the ways that you try to stay ahead of the curve and anticipate the needs of a growing team?
Yeah, absolutely. And I've worked in different organizations over my career, large, small, and you always have these kind of challenges with growing and bringing on new people. And I think it's all about how do you establish a really strong culture, a culture of collaboration, a culture that can scale. And sometimes those things don't interact well, right? Yeah. It's like, how do you build a team that can really work asynchronously? Everyone's remote now. Yeah. We have 8 different time zones represented.
Wow.
And so how do we collaborate together? How do we work together? How do we communicate? How do we find ways to get people's input, but also not have to take up everyone's time with meetings all day long?
Yeah.
And so we've brought some experts in to help us build that culture, some executive coaches, some people that would help us build out our policies and practices, and I think it's helped a lot.
Okay, so one of your strategies was to seek outside counsel and to really get experts to come in. What's one thing that they helped you implement?
Yeah, really starting with our why, right? We did a redo of our purpose and our mission statements, really had to get on the same page, from just being a Nick and me thing to a company thing. Now that we have executives and different individuals at the director level, we wanted their buy-in as well. Mm-hmm. And so even though we're the co-founders, we wanted to bring in the entire team because they're part of that mission, they're part of that journey, and all their opinions matter. Okay.
Now break it down for us exactly what you've built with Pear Suite.
Yeah, originally we're helping older adults navigate the healthcare system with the social determinants of health. During the pandemic, people understanding what vaccinations are all about, how do we get them, but also helping with things like housing and food, what we call the social determinants of health. We recognize over the time that lots of other individuals have challenges with the social determinants of health as well. It's not just older adults. Okay. The Medicaid population, those who are disabled, the LGBTQ population, people in rural and remote settings. And so we really developed a platform to enable community health workers, which are these lay workers, frontline workers that are amazing at building relationships, understanding needs, and providing navigation services to these resources, and building a platform to help them scale this work, collect good data, and help work with the healthcare system.
Help us understand a little bit more about these community health workers. Who are we talking about?
Yeah, these could be individuals that maybe have studied a little bit of nursing and maybe dropped out and wanted to become more of a frontline public health worker. Some of these community health workers were trained during the pandemic to be COVID case managers or case tracking the COVID. A lot of them are maybe not even having graduated from high school. These are people from the community. They've experienced life. They've experienced things like housing loss or instability with their job, or maybe they are formerly incarcerated. These are people with lived experience. They are oftentimes bilingual. They come from the communities in which they serve, and they're great at building these relationships and understanding the needs, and then helping people navigate those resources.
And explain to me in really kind of tactile terms how you've evolved their workflow.
Yeah, a lot of these organizations that are hiring community health workers are nonprofits, small community-based organizations. It could be a church, it could be a YMCA, it could be groups doing screenings at the local health fair. A lot of these groups aren't on your EHR systems, they're not on fancy systems to collect data. They're using paper and spreadsheets and notepads. So how do we take what they're doing on a day-to-day basis, build a platform around those workflows, help to scale their work by getting good data, and tying it back to the healthcare system by making it actionable? Collecting codes for billing, helping to track time and different activities, and scheduling out things in advance with recommendations.
Got it. Talk to me about the business model, because when you describe helping somebody like an almost volunteer community health worker, maybe they are even volunteer, we're not talking about high dollar transactions here. So how do you make the business work?
Yeah, we started our organization really supporting these small nonprofits, and these nonprofits don't have a lot of money. So we did it really to understand the market, who are we serving, who are we building a platform for.
Yeah.
Sometimes you think about technology is really built to help scale this work, but how do you build technology and use tech to make it simpler and easier to do simple tasks? And for those who maybe aren't tech literate, maybe they don't speak English very well, maybe they don't understand the concepts around healthcare that really is important, and you might see at a social worker or case manager or a doctor level. And so we use technology to really upskill and empower these group members. Our platform helps to collect this data and really tie it back to what are the needs and interests of health plans and health systems. They care about Z codes, they care about addressing these social needs, they care about increasing engagements, reducing healthcare costs, reducing ED visits, increasing annual wellness visits and screenings, and we're kind of bringing it all together. Of course, that could be in the form of just our platform as a SaaS offering, a solution. We provide our software to organizations that want to just use that. We also work with health plans and health systems that need our support from our community health workers. So we also have a tech-enabled services platform side of our business as well.
Okay. And where are you seeing the greatest traction?
Yeah, we did really, really well with these nonprofits, these small groups that really the healthcare system knows are essential to addressing social determinants of health challenges, but they didn't have a clue how to work with these groups. We proved that we can work with them, upskill them and get them on our platform and keep engagement high.
When you say upskill, I'm going to pause you.
Yeah.
What do you mean?
Yeah, helping them do things that they didn't know they could do. So
Yeah.
we actually have a recommendation tool that will suggest things to them around resources or programs or maybe supplemental benefits they didn't know they had. These are things that previously these organizations and community health workers have to think on their feet. They have to think of it on their own, and they wouldn't have any suggestions or recommendation tools. We could also use data to make data actionable now. So our analytics tools and our dashboards will actually suggest things and make it easier for them to close the loop on these resources. And so that really helps these community health workers do their work faster, cheaper, easier, at scale, and more effectively as well.
Got it. So you've sort of identified who these folks are, who are incredibly influential in their own communities, and then figured out how to kind of lift them up, empower them, help them do more.
Exactly. And now the health plans are excited, right? They want to know how to work with these groups as well. Health plans know they can't address food access on their own. They don't know housing. They don't know how to get people from the Medicaid population into the healthcare system to get on technology to use telehealth. But these community groups do. And so if we can be the bridge between these groups that are doing this work every day, who have the specialty and the skills and the resources in the community, with the health plan's interests, we can really close the loop on the healthcare system's biggest gaps and make the health plans really, really happy. And they've been very excited to work with us. They're paying us to work with these groups. We actually have 100 organizations in the pipeline to implement over the next year.
Fantastic.
So they're very excited to work with these groups, but it's not easy.
That's a fantastic pipeline. What do you think it is that is, if you could put your finger on something that's kind of triggering for them, it's like, we need this. What is it that's kind of piquing their needs?
Yeah, obviously there's money involved in business transactions, but we're seeing this policy shift across the country around reimbursement for community health workers.
Okay.
Previously, community health workers weren't being paid by any Z codes or billing codes because it wasn't recognized as a profession. They aren't certified, but a lot of organizations, specifically Medicaid plans, are seeing, our Medicaid systems and Medicaid states are seeing that these are really the key to addressing social drivers of health. And so they've actually adopted billing practices and reimbursement codes for community health organizations, community-based organizations to do this work. And so now if we can connect the dots, health plans can actually activate these groups without having to pay them directly.
Yeah.
The Medicaid plans will pay for them.
And that's a regulatory shift that's been relatively recent?
Absolutely. We just came back from Kansas where we closed a new contract. July 1st of this year is when they started billing for Medicaid through community health workers.
Fascinating. Well, Colby, love getting the update. I hope that next time we talk, it's as much growth or 10 times more, because I know that you're really helping these folks on a community level. And I love how you're empowering community health workers. And I love that the incentives are aligning so that people who are paying for this work, it makes sense for them too.
Absolutely, and thanks so much for you and the team. We really appreciate all that startup health system for our company.
All right, keep it up, Colby.
Thanks a lot.